So hi guys. So today has been a busy day, but I wanted to tell you something about my nursing school progress, the application. So the thing is, before you apply to nursing school, you're supposed to get some vaccination. You're supposed to get some CPR, BLS, basic life support CPR for healthcare providers. That is slightly different from CPR, the regular CPR that people get. So I'm just from that class, and I've learned quite a lot. And it's all about doing CPR on everyone, kids, old people, anyone who needs CPR. Remember, if you have somebody who has had any experience of maybe a heart attack or even choking or just about anything that you may want to help them in any way, do a CPR class. A CPR class will save you, will save the next person, will save your loved one, will save your kid, will save your mom, your dad, whoever. Like now, I know of stories where people have had, maybe you collapse at home and you find that person on the floor. What are you supposed to do? You're supposed to do a CPR, especially when you notice they can't breathe and they cannot respond to your cues. Respond to your actions. To your noise. You're supposed to shake them first, ask them if they're okay. If they don't respond, lift up their head, check whether they're breathing by listening to their breath. You can also put a pulse here, like put your hand here and feel the heartbeat. Sometimes you can feel the heartbeat thinking they're doing fine, but remember, dying takes about 4 minutes. You can actually save someone within 4 minutes by doing a CPR. So when you see someone on the floor lying down and you check their pulse, especially this one, and you feel the pulse but they're not responding, that means they're heading to trouble, they're heading to death. And that's why I'm becoming a nurse, to come and save you guys and give you information that is going to be helpful to you and your families. Okay. The second thing, when you notice that they have their pulse, don't leave them alone. You're supposed to do CPR, pressing on their chest several times. This is a skill you must learn. I cannot tell you here because I'm not licensed to tell you here. But when I become a nurse or a CPR instructor, which I'll be giving CPR lessons to some Kenyans or to some people here, or even back home. You never know. Some of these things are skills that you learn for a long lifetime. And the information keeps changing every single, about every 2 years. Well, every 2 years, there's something new that they've noticed with the skills that they are training us. And so you need to renew your CPR every 2 years here in the US. I don't know about Kenya, but I'm pretty sure the nurses can tell us in Kenya, or people in the medical profession, clinical officers, they can inform us on what we're supposed to do. Okay, number two, something that I was doing my immunization for hepatitis B. Hepatitis B protects you from blood pathogens, just in case you get an injury from a needle when you're working with a patient. Hepatitis B makes you immune to any kind of bacteria that will get into you. This does not mean I cannot get HIV or anything like that, but it protects you from most of the pathogens that you'll come across when you become a nurse or a healthcare profession. My job is actually paying for that. There are 3 shots which you're supposed to take. So if you're planning to go on to nursing school, when you're starting a prerequisite, I will advise you talk to an advisor. Ask him or her about immunization that is required during nursing school, like during your clinicals. Okay. So you're gonna ask them that when you're doing your prerequisite, because hepatitis B takes about 8 months to complete. I took the first shot a month ago. I should have done a video on that. The second shot I've taken just right now. It's not painful. It's pretty easy, not complicated. But it protects you for a long time for many pathogens. Okay, so my immunity is crazy right now. I got measles shot again. If you got measles shot at home, that was not enough. I got 2 measles doses. That was some time back, because whatever they gave us back at home, It was not enough to give me immunity to measles. I could get measles again, but with the vaccine that I've gotten here, I cannot get measles. Even if I won't be affected. If I'm working in the hospital, I won't be affected because I'm immune to measles now. I also got something called varicella. Varicella is, I think, a pathogen that causes smallpox or chickenpox. I'm not smallpox, I think. So what happens with the virus? So I'm here at a gas station. I want to fuel my car, and I show you how we fuel. So we get that varicella also, a shot, and also the TB test that we do back at home, or the BCG we get at home. We actually, if you were exposed to anyone with TB, you must get medication here to actually make sure that you're immune to TB. So my doctor told me, the people who keep saying that getting a BCG makes our skin test positive for TB here in this country, that's not the case. You are positive if you are tested. There's a test called TB gold test, quantiferon gold test. I'm telling you, I'm becoming a doctor, girl. So that test showed that I was positive, but I don't have infection, so it's inactive, just the same way as the human papilloma virus, where everybody has it, but it gets active when you get into contact with someone who has an active ingredient. I don't know how easy to make that, how easy I can explain it. So that TB test has actually shown that it's positive, so I'm supposed to get a chest x-ray, but that test is actually valid for more than 10 years. So I'll be in the healthcare industry for a long time, so it will be valid for 10 years. So after 10 years they do another test, and of course I'm waiting for the results for my chest x-ray. I believe it's negative because I don't have any TB symptoms. Okay, that's it for the TB. There's also another one, Tdap. Tdap ni tetanus. It's like tetanus. So when I was pregnant here, they gave me a shot of tetanus. It's valid for 10 years. TB, I think it's forever. I think so. But for the tetanus, it's valid for 10 years. Okay, so the next thing I took, I think, what else? COVID shots. You must get COVID 1 shot, COVID 2 shot, and a booster shot for nursing programs. So people who have not had their shots, if you're applying for this, just know you'll be required to have it, because most hospitals, most facilities will ask for all those vaccinations. Okay, so now I'm immune, guys. I'm immune, like seriously, like nonsense. Okay, so I'm gonna fuel my car. I'm gonna show you how much. Fuel is expensive, but I believe it's gonna get lower a little bit sooner if president says it or signs a moratorium or whatever it's called. Fueling is a shuka, which is a good thing for us. So yeah, so let me just show you.